Okay, I think in view of time, we will start, Dr. Darpan.
Yes, Lisa, please begin.
Okay. Good day, everybody. And on behalf of the Art and Culture Subcommittee, Psychiatry Society West Zone, I welcome you to today's Manitarang series. Today's topic being a very interesting, intriguing topic, I would say, photography and mental health. And as we know, a photograph tells a story, it conveys an emotion, or it focuses on exploring a topic. So, somewhere there seems a deep connection between mental health and photography. So, without further ado, we will start off with our program and so that our esteemed psychiatrists who are will be speaking today and displaying the photography will throw some more light for all of our information. So first of all, would like to welcome Dr. Sudhir Bhavi, sir, but due to some unavoidable this, he would not be able to make it as of now. Next, I would like to welcome our chairperson of the Art and Culture Subcommittee, Dr. Darpan Kaur, uh, who's the main person behind the idea of Manitarang. She's a professor of psychiatry at Department of Psychiatry, Mahatma Gandhi Mission Medical College and Hospital, Navi Mumbai. She's the founder and consultant psychiatrist at Satguru Mind Care and We Mind Mumbai, and she's our chairperson. She has won many awards, of which some are top most leaders in mental health award. Life is Beautiful Like a Sweet Rose, a poetic photograph at World Psychiatry Association Regional Congress, WPRC 2023 art exhibition. She also had another exhibition of the Sweet William, the Marvel of Peru, and the Hibiscus Rosa Sinensis, a floral photographic series. She was part of it at the IPS West Zonal Branch Midterm CME 2024, and also the art exhibition Kaladalan, the expressive uh, visions. So over to you, Dr. Darpan. We welcome you.
Thank you so much, Lisa, for the wonderful introduction. And I'm very grateful to you for reading out my CV. And thank you to you, Lisa, for taking the lead in coordinating the program and moderating it this month. So I'd like to welcome all our esteemed dignitaries and our speakers on photography and mental health, as well as the psychiatrists who will be speaking on their photographs and mental health. So this is the Manitarang webinar series organized by the Art and Cultural Subcommittee, and it's a monthly psychoeducative webinar series on art, culture, creativity, psychiatry, and mental health. It's organized by the Indian Psychiatric Society Western Zonal Branch, and in my role as the chair, it is an huge and immense honor for me to chair this session, and we've organized so far 6 webinars on different aspects of creativity, psychiatry, and mental health. The first one was on storytelling. The second one was on poetry. The third one was on music. The fourth one was on dance. The fifth one was on singing. And this month in June, we have the 6th webinar on photography and mental health. And joining me today, the moderator is Dr. Lisa Mascarenhas. She's a member of the Art and Cultural Subcommittee, IPS Western Zonal Branch. Dr. Sudhir Bhave, sir, was supposed to give the welcome, but he hasn't been able to join so far. So I welcome you all on his behalf. And Dr. Lisa, if sir joins in between, then we can invite him to give his speech as well. And vote of thanks will be given by Dr. Alkesh Patil, the convener, Art and Culture Subcommittee, IPS West Zone. So moving to the next slide. Next slide. Well, our webinar series is in a format of 6 psychiatrists. So every month we have 6 psychiatrists from the zone representing Maharashtra, Gujarat, and Goa participate in our Manitarang webinar. And we generally have 3 speakers and 3 psychiatrists who showcase their talent on the theme of the webinar. So in this webinar series on photography and mental health, we will have Dr. Jai P. Shastri, consultant psychiatrist, Mumbai from Maharashtra, Dr. Chetan Hansalia, consultant psychiatrist, Rajkot, Gujarat, Dr. Jeet Nagpara, consultant psychiatrist from Vapi, Gujarat, who shall be speaking on the topic of photography and mental health and the role that photography has played in their life, the journey as a psychiatrist and a photographer, and how photograph has different aspects in relation to the brain, the mind, memories, beautiful images. So with all of this, they will be as a panel speaking on photography and mental health. Then we have, after the session is over, we will have three psychiatrists who will be displaying one of their photograph, the most cherished or the most brilliant or the best photograph that they have clicked. And we have three psychiatrists: Dr. Amol Deshmukh, consultant psychiatrist, Aurangabad, Maharashtra. He is also the EC coordinator of our creativity and mental health art and culture subcommittee of the zone. We also have Dr. Karan Braganza, consulting psychiatrist from Bambolim, Goa, and Dr. Arya Prabhu Gaonkar, consultant psychiatrist from Margo, Goa. They shall be displaying their photographs and will be discussing about the aspect of photography and its link to mental health. Next slide. So this is the overall program outline. We begin with the welcome address, introduction by me. Then we will have the speaker series for say about 15 to 20 minutes. And then we'll have the photography display and discussion, which will be the next 15 minutes. And they've titled their photographs very beautifully. Dr. Amol Deshmukh's photograph is titled Shutter Your Stress. Dr. Colin Braganza has titled his photograph, It's All Falling Apart Still. Have you seen such a beautiful world? And the third photograph by Dr. Arya is on photography as a stress reliever. And then that will be followed by the vote of thanks by Dr. Alkesh Patel. Next slide. Next slide. Yes. So it's my honor to welcome the first speaker in the panel, Dr. Jai P. Shastri. He's a consulting psychiatrist at Dr. Shastri's clinic. He's an honorary psychiatrist at Jai Vakil Foundation, working in the space of children with special needs since 2000. He is visiting faculty at Department of Psychology at NMIMS since 2022 till date. He's past honorary treasurer of BPS 2020-22, past honorary secretary, IPS Western Zonal Branch 2014 to 18, and past honorary treasurer, Indian Association of Biological Psychiatry 2013-17. He is a great photographer, an amazing human being, and a wonderful child psychiatrist. And he's having a very excellent interest in photography. So we look forward to getting key insights on photography and mental health. Over to you, Dr. Jai P. Shastri.
Okay. Thank you so much, Darpan, for that wonderful introduction. And at the onset, I want to thank the Office of Psychiatric Society of Western Zone, along with the Art and Cultural Subcommittee members, for inviting me for their monthly psychoeducative webinar series, Mantarang. It's really honor to be here. It's rather interesting that how different aspects of our day-to-day life can be associated with mental health, and their interplay blends into something meaningful at the same time educative. Today we are discussing about photography and mental health, and I would not call myself a pro as far as photography is concerned, because there are much more what I would say senior and qualified photographers on the panel. But then I'm surely the designated photographer for Shastri Parivar. And whenever I click, the outcomes are reasonably good. And the other speakers, they have got wonderful discussion lined up when they are going to talk about different aspects of photography and mental health. And I thought we'll try and be a little more technical, and also try and look at different aspects of how photography affects mental health. So I'm not going to showcase any photographs, but then I'm just going to throw open certain ideas, rather talking about journey on how photography has transitioned over a period of time. Uh, So from the time I started my practice until we are today, so we are talking about more than 25 years. I still feel very nostalgic when I discuss this, that in my early years of private practice, when I was shadowing my father, Dr. P.C. Shastri, where he would make me understand different cases and answer silly of my questions with utmost calm. He would reach out to one of our side drawers in the clinic and take out few photographs. So during those days, it was one of the way of understanding how the psychopathologies were presented, and those were not the days where consent would be such a big issue. So the clinicians would click photographs and keep them as a part of educative as well as learning material. And I've seen such a wonderful transition of what our intervention does to different patients and psychopathologists. So one of the picture I still clearly remember was about a case of alopecia, a young lady who had a wonderful hair growth early on, and when she was suffering from alopecia, how the entire transition has taken place, and with her treatment intervention, how she has improved. So the entire transition shown through series of photographs. And then, of course, since he was very much interested in developmental space, which I have picked up after him, he had many photographs of children with disabilities and certain special features, facial features, especially if you talk about, say, Down syndrome and how Mongolian features would look like, and how Fragile X faces would look like. So those were the days where communication was not as easy as you would do in today's time, where you just click a photo and send it to different people. Photography was a rare talent, and it was a cherished kind of activity where you would collect all these materials and use it for educative as well as training purpose. Another interesting aspect of photography was about also how we presented our different lectures. I don't know whether all of you have that kind of awareness or knowledge, but then those days the presentation also would be in a form of photographs. You would have negatives of each and every slides, which would be in a form of a small bracket, and it would be loaded on a mounter, and you would have a projector which where you would put slides with those negatives, and it would be projected on a white screen. And it was an effort. So carrying a PowerPoint presentation like what we now do in the form of one simple pen drive, in a form of small MBs, but then on those days the PowerPoint presentation would be in a form of series of pictures put in those blanket in a big folder. So definitely the utilization of photography and photos in those days was very useful, but it was quite cumbersome. Cut to today's time, where photos are considered as one of the very important digital footprint in understanding how human behavior works and the mental spaces works. And to take photographs, you just require one click, right? So, and there are GBs and GBs of photos. At times, you wonder how and when you will be ever able to see the photographs. You have all the enthusiasm to click photos, but whether you have time, energy to see those photos. So that's another area of concern. I had one young girl who came to me, one of the psychology students, and he told me that, sir, I have so much of material with me. I don't know what to do with that kind of material. So much photos, books. So it's a form of digital hoarding. And whether we will be able to ever utilize or see that kind of pictures which we are enthusiastic about while cheating. So, of course, you click photos and you utilize for different purpose, whether you upload it on a social media. One can also use it to morph and create problems for others. Also, you can use it in one of the PowerPoint presentations. So the photos have definitely, or photography has become much more easier, advanced, developed, and the utility is also be multifold. And what I'm going to do is discuss few applications or studies where photography and mental health they cross roads with each other. So there is this interesting study titled Take a Picture, the Role of Visual Methods in Understanding Patients' Everyday Life. The aim of this study was to see the patient's experience of mental illness and how it fosters into better support for a particular population. And here, their idea was to pick up especially patients with psychotic illnesses and how they are able to express through different photos or photography, and how they are able to connect with the healthcare providers. So what they did was they gave a group of patients who had psychotic illnesses, and they asked them to click photographs with different themes, and then which was followed by a structured interview. Interestingly, what happened as a part of the research, this qualitative study reported that the patients were able to express their emotional feelings, their inner concerns through photographs much better than how then they could verbalize it. So the take home is that photos can be a very important and an interesting medium to see the different aspects of treatment. So just give you one example from this particular study. There was a picture of tablets being taken, and through unstructured interviewing, they could understand the aspects of compliance and various difficulties that patient went through, which they were not able to verbalize into their routine conversation. So that's photographs as a part of expressive tools. Another very interesting method which is shaping up is the photo voice method. Now, photo voice basically uses people's photographic documentation of their everyday life as an educational tool, and to record and reflect their needs, promote dialogue, and also encourage action and inform policy. It is a very important tool in certain niche areas, especially when you talk about pediatric, geriatric, disability, as well as underprivileged space. So that's another important aspect of photo or photography, which we supposed to be mindful about or aware about. Third, one of the very, very important and upcoming field is about photography as a part of big data or digital footprint. We all know big data analytics is revolutionizing the mental health space by enabling researchers and practitioners to analyze vast amount of information to improve, to predict, to prevent, and to personalize treatment of mental health condition. Now, this particularly uses electronic medical health records, social media records, where photographs can be one of the digital points, wearable sensors, and other sources to identify at-risk individuals and also offer them newer therapies and individualized treatment plan. So what typically happens is through artificial intelligence and machine learning, we are processing this big data. And this particular aspect of health is called intelligent health or also iHealth. And this provides information to more contextual data from the patient, which are from their personal environment, which is very, very immediate, or which is very, very the monitoring is almost real life or real time. And what it also enables us is to take decisions in form of assessments. It helps a patient to self-monitor their progress, to understand how the therapies are working, how the outcomes are being analyzed. But as this particular process as a big data and understanding of photographs as a tool of mental health, it also has a few challenges that we need to keep in mind. One of the very important challenge is the ambivalence with regards to autonomy. So when you are giving self-reports, or when we are presenting different data to individuals, whether they are in a mental space or they have ability to handle that data, which is one of the very important aspect of big data and the way we analyze. Of course, there are issues of privacy, data privacy, private piracy. And when we are processing data, the amount of data which is being gathered is such a huge that you have to create certain algorithms where there are simplifications of this data, what we in technical term call as datification, and that might make things little more generalized rather than individualized. So and also create certain biases depending on the kind of touch points that we introduce in data analysis. So though this technique of big data analyzing different aspects of social media, the photographs is upcoming and very, very interesting, it has its own glitches and that we should be very important and mindful about. And finally, one of the important considerations about photo and various photography is how it affects psychopathology. While photos do not directly cause psychopathology, they can definitely trigger some sort of symptoms or have a contributing factor in contents of different psychopathology. The way users they engage into with important aspects of images and interpretation of these images, particularly social media images, can impact one's social self-esteem and trigger conditions, especially the one which is in focus is body dysmorphic disorders. The act of taking photographs. Now, it can also be a trigger. We know so many people who completely despise taking photos or want to be engaged in that particular phenomena, and that can also create some sort of relational conflicts or minor psychopathologies. And while we are on act of taking photos, we know how dangerous it can be and life-threatening. We have seen so many cases of accidental death while taking photos. So that also needs to be taken into consideration. So to conclude my discussion, photo and photography has definitely transitioned big time from a simple educative tool in the earlier times to maybe armamentarium, which is giving us more deeper understanding about mental health. Also, it is giving us more being a precursor to a personalized treatment plan. It also helps us understanding our brain and the functionality of it in a more better way. And also, finally, it can be also triggered to various mental health conditions and death. So it is up to us humans to maybe we vary and understand whether you want to make it a genie, which provides us with various wishes and good outcomes, or you want to transition it into a demon which is going rogue and creating more problems for ourselves. So that's where I'll stop, and I'll then be here around to listen to other various wonderful speakers. Thank you so much.
Thank you, Dr. Jai, for your excellent and very insightful talk. And it was very, very comprehensive and very wonderful to listen to such great scientific insights on photography and mental health. And we'd like you to stay back a little bit time more, because after all the speakers and the photograph are presented, say by around 11:45, 11:50, we'll be just having a small Q&A with the audience, or Lisa will be moderating a question and answer session. So please do stay back, and thank you so much for your great talk. And now we move to the second speaker, who is Dr. Lisa. Can you please share the next slide? We welcome the second speaker, Dr. Chetan Hansalia. He is a consultant psychiatrist at Jash Hospital, Rajkot, since more than 25 years. He's worked as a consultant as well as an honorary psychiatrist at various hospitals in Rajkot. His other interests include badminton and has won numerous medals. His a keen interest in photography and photographs being published and displayed at various exhibitions. So it's a great honor to welcome you, Dr. Chetan Hansalia. I've seen all your wildlife photography, and I remember your photography on the Gir lions. And I'm your friend on Facebook, and I know that you take great wildlife photographs. So it's an honor to welcome you, and looking forward to getting and understanding your useful insights on photography and mental health. Over to you, Dr. Chetan.
Yes, thank you, Darpan, for kind information and kind sharing. Please stop your sharing so I can share my slide. Yeah. Is it visible? Yeah. Okay. Thank you, IBS Western Branch Culture and Art and Culture Subcommittee. And a very interesting topic today. Thank you for inviting me and express my thoughts and express my experience. Thank you about talking. I will be glad to share you my thoughts about photography and mental health. Usually I talk about the positive part, might be some negative parts, but today we'll talk about the positive part. We are for the good part. I'm a psychiatrist by mind, but as a photographer, by heart I'm a photographer. And this is some of the glimpse of my photographs you might be seeing on Facebook. In general, just in brief or in short, why taking photos can actually improve your mental health. Because having some good skill or some different skill help you to boost up your self-esteem. The better you feel about yourself in happy years, the stable your mind and tend to be, you make even more stable your mind and you feel the more positive mental health. Photography is also a creative process. It doesn't not only just taking the photos and the process is over. Post-photo process is a somewhat busy and some tedious process and take more time than photography. So you need some creativity on that photographs, and that for creative process and create is not always everybody knows reduce anxiety and uplift your mood. Like this one. And today I'll try to finish my lectures in 10 minutes about discussing this around 8 topics like promote the mindfulness, help to reduce the stress, give you a creative voice, encouraging physical activity, and provide social connection, give you a purpose in your life, allow you to promote the process the emotion, and help you manage your life. Try to discuss first thing is promote the mindfulness. Just yesterday, I'm just listening the conversation between the Prime Minister and the Modi and astronaut Subhanshu Shukla. Modi asked the question, how the mindfulness meditation help you in your this adaptation process? And so our group commander, Dr. Mr. Subhanshu Shukla, give the express and best example is the best answer. This mindful meditation helped me a lot to lots helped in our adaptation this new situation. And I'm just writing my progress slide. So I hate this because nowadays the mindfulness meditation has become the mainstream in all the past decades. In practice of photography, you have to force, you have to commit, you have to concentrate, and you have to focus on the present part. You can't worry about the past or you can't concern about yourself with the futures because there is some focus in your life, there is something in front of you. So you have to need only focus on the present situation. Because KRA, many is when you find the good moments, you can know. You have to find or not, you have to find it. So doing this constantly can help you to improve your negative thoughts, remove your help to remove negative thoughts, replacing them with some positive instead. Consuming photography can have the same impact as well, remove the distraction and methodically focus your attention on each frame, taking it all on the living in the moments. So you have to live in the present moment only. You can't focus surrounding people, surrounding photographs like this one. I focus so I can able to catch this kingfisher tossing the garden lizard, and I can able to catch the perfect moments for myself. Thank you. Then this help to reduce the stress. Definitely, life is not easy. Always a stressful job, stressful home, stressful life, stressful profession, stressful routine. It's same. There is no infinite pathways to stressful existence. With that, we must find a way to reduce the stress. Not a way. How you process yourself to reduce the stress is upon you, and you have to find your way to reduce the stress. My way is photography is great for because it is allow you to carefree and do something you actually enjoy it. When you are by profession, not by profession, but by hobby, you are a photographer or freelance photographer. Definitely, you are enjoying the photography. Like professional photography always come with some stress, like there's some require some commitment, require some monetary, or sometimes you have to force yourself in the professional photography. But for our personal work and for the love for it, photography is a wonderful break away from the pressure of being alive. Like usually I roaming around surrounding the Rajkot in Sunday in morning around 2 or 3 hours. Definitely is a very relaxing mode, relaxing situation, relaxing time to get some good photographs surrounding the Rajkots. This from the Sasan. This photography definitely give you some creative voice. Even if nobody see your photographs, knowing you took something for your mind, brought it to reality, can boost your confidence. Doesn't matter how many likes you achieved or in Instagram or in Facebook, or how many comments or how many followers with you. Just for you, the photograph give you a satisfaction. That good photograph boosts your confidence. This confidence impact your self-esteem, which then impact your mental health. And several studies have shown people who express their creative voice are happier. Picking up your camera and being creative will do a wonder for your creative and general confidence. I say definitely it's creative voice, and sometimes you need some photograph. Even is not in good, but by your creativity, you can make it in a different way, making them some different angles and some different composition that give you other angles in the opposite parts. Always you feel for the better creative voice, you can feel your confidence, like different composition, black and white pictures, give you some creative notes that boost up your confidence. Even not taking the simple photographs, but creativity definitely help you to increase your mental health or positive mental health. Definitely encourage the physical activity. When we leave for the trip for the photography trips and especially for the jingles, I am just carrying more than 10 or 12 kg carry bag on my shoulders. I say in my family, this is my bacha, is third bacha. Two bacha is there, but this is my third bacha. I have to take care about my carry bag. This composing of 2 cameras and 2 big lens and other laptop on this side. Stuff is around more than 10 or 12 kg. I have to carry throughout process in the all the activities during my small trekking or small walking track. I have to carry on this one. This gives us some physical activity. It doesn't matter if you are a travel photographer or working in the home studio. Doing a photography requires some form of physical activity. Suppose you have a lens or camera on your hand is more than around 3 or 3.5 kg a hand weight. You have to carry or you have to focus and require 2 or 3 hours you have to carry on your hand. So definitely is required some physical activity. As someone who doesn't street photography, it's not to say street photography, you are walk in miles. And definitely that give you around 10,000 steps of this physical activity. But even in other activity, photography, you also find the physical activity. We all know by the now physical activity is good for mind, definitely. It will release a certain chemicals like endorphin of course, and is keep our body healthy and which good for our mind too. The best part of being photography, it doesn't feel like exercise. When you take the photography, you are running or roaming around, you can find you are walking around 3 kilometers or 4 kilometers because you are focused on all the activities, or you are searching for the good moments, you are searching for the good birds, or you are searching for some good photographs. You are unaware about your physical activity. So side by this exercise is secondary, but it still give you a benefit you would get from the running or other form of physical activity. Walking in the jungles. Provide a social connection. Just say we are the Facebook friend. That provide the social connection, and that help me to improve our friendship list. Definitely, human desires social connection. It's a part of our evolution and highlights in the Maslow hierarchy of needs. The measurement of what human need is happiness or happy, to be happy. So photography is a social human connection. For example, a portrait photography has to connect with so many different people throughout their careers. It is very intimate process to you as you encourage people to be a best version of themselves. This is about the routine about the portrait photography. But in routine photography, is connect the peoples with the same mindedness, or increase your friend list or group list with the same mindedness. So it is not just as a type of photography you do either. Within their genre, you can find the communities that meet up and go on the photo walk. They often take the time to chat after, and you can have a social connection with the like-minded peoples. The photography workshop are also useful to meet the other photographs. And like this type of my photography hobby meets this today the other peoples. Here we have a very good group of photography club of Rajkot. We have a regular meeting and regular update and regular workshop and regular discussion about how to process the photograph, how to edit the photographs, which angle is better, which composition is more, what is the rules of composition, what is the rules of colors combination. These give you some more people to connect. These provide definitely Instagram, Facebook, and WhatsApp is nowadays increase the social commitment or social communication. Definitely give you a purpose of life. Many people, I think we can phrase or we can aware, many people who are struggling with their mental health often speak about not having a sense of purpose in life, of goal. They are unsure about who they are and what the role of inner works. These are main basic complaint or basic sense of the people who are struggling with the mental health, especially for adjustment issue and especially for the personality issue and for the depression. After beginning to practice the photography, and all of a sudden I felt I have an identity as a photographer. That gave me reason to get up each day and enjoy the life. This gives identity or some purpose in my life. It doesn't matter if you are good photos or good photographers. If photos is in your heart, it can give you so much more in your life. Knowing where you belongs and what you want to do in your short time, here can certainly improve your mental health. Don't overlook photography's role in that. But nowadays, in era of mobiles and smartphone, everybody is a photographer, taking the photographs, making the reel, making the program, putting the on the social media. Even small moments of each and every day, some people are very crazy or very upset, I can say, the psychiatrist, to put the 3 or 4 selfies in the routine in a social media page. They are used to for it, and they have a purpose to put the selfies on the social media. This is a purpose. Whether it is positive or negative is the second thing. How to reassess the past. When you take the photographs or seeing the photograph of the few times, a few years, definitely is remind you of the past. Remind about your activity at that time, and definitely you have time to reassess about your positive power, reassess about the positive moments, reassess about the guilt, reassess about some mistake what you're doing that particular moments. Definitely help to reassess the past. And the images I made during the time made it look like a best. The photograph are not being the deceptive. In fact, their evidence is that bad as they think were. That was a lots good during that years. So spending time with the images reduce the trauma. I have from being the several ill people's timing when you are especially I just give them my example. When I was a corona, I had corona and I was admitted in the hospital. That was the time I passed through the assessing the photographs and improve myself to edit the photograph, especially taking the mastery over the Photoshops. That 7 to 8 days, I just doing this thing, how to edit the photographs. So sometimes this type of, I was corona positive, and thanks Lord, I'm not more severe, but that 7 to 8 days in my hospital, I passed to this type of activity. That nowadays I'm reassessing my past is good for me. That allow you to process your emotions. Picking up your camera.
Sorry
Yes.
to interrupt.
Yes.
The chair, I just need to give you a reminder. Thank you.
Okay. Just allow you to just 2 minutes more, Darpan. This allow you to process your emotion during this photography. Just I give one example, photographer Carly Clark. They will take the photograph during the journey of battling the cancer. And when you are facing the life or death, you just have to get through it, said the Clark. And these are final notes. Practicing photography is known to help you more mindful, which is turn it can reduce the stress. Consuming photography can be equally beneficial for helping to manage your mental health. And photography can help you manage and process life experience, thus minimizing the pressure that put you in mental health. Thank you. Thank you. Sorry for 2 more few minutes.
Thank you so much, Dr. Chetan Hansalia. It is an excellent presentation and very, very great scientific PPT and a photographer and psychiatrist presentation on photography. So thank you so much. All the useful points you have shared will be very useful to all the people who are attending this webinar, and also it will be uploaded on YouTube so people can read and understand from the presentation, but very excellently made slides, very beautiful photography, and very well spoken. So thank you so much for being part of the speakers series. And we request you to just wait for 10-15 minutes more till towards the end, where we'll request you to be a part of the panel of Q&A as well. So thank you, Dr. Chetan. May we have the next slide? It is my honor to welcome Dr. Jeet Natpara. He is the owner and CEO of Shant Man Psychiatry Hospital, Vapi. He has an advanced certificate course in management of addictive disorders, addiction medicine from NIMHANS. He is joint treasurer at Indian Medical Association, Vapi. He's worked with Telemanas Seva during COVID-19 and Government Hospital Daman in 2017-18 and beyond, and renowned speaker conducting public lectures, nursing students and psychology students training programs, school lectures, seminars on mental health awareness and reels at local places since past greater than 9 years. And as he also mentioned, he's played an active role last year on the Art and Cultural Subcommittee of the IPS Western Zonal Branch, and he has a keen interest in photography. So we welcome you, Dr. Jeet Natpara. Over to you to get some good insights on photography and mental health. Over to you, Dr. Jeet.
Thank you so much, ma'am, for inviting me for today's program. I would like to share my slides also. So allow me to, yeah. Just a second. Is it visible to everyone? I hope the slides are visible to each and every one of you. Yeah. So photography and mental health. I have a different perspective all around other than the speaker. And I would start with the basic things like photography is an art, science, and a practice of capturing light to create images. The images can be captured digitally using a camera, smartphone, or a chemically used film. Photography as both art and science has a different perspective. Now, there are different types of photography. Some say some are portrait, landscapes, street, documentary, fashion, sport, wildlife, macro, and many more. So in modern context, photography is used for personal expression, social media and communication, art and creativity, journalism, storytelling, scientific and medical documentation, marketing, and advertisement. And there are many more use of photography as such. So photography is more than just taking pictures. It's a way of seeing the world, preserving memories, and expressing ideas. Now, what is the connection of photography to mental health? Let's see. photography isn't just a creative outlet, it is also an increasingly recognized as a powerful tool for supporting and improving mental health. So, mindfulness and presence. The photography encourages being in the moment. When you are framing a shot or focusing on a subject, you are practicing mindfulness. As earlier Jay Sastry sir told the same, it is known to reduce stress and anxiety. It can help to break the cycle of rumination and overthinking. So a little case I would discuss here. There was a 14-year-old boy who had come to me with a complaint of recurrent behaviors and repetitive thoughts. Parents complained that he keeps on counting numbers anywhere and everywhere he sees. On not allowing him to do so, he gets very anxious and very irritable. While doing this, he is not aware of his surrounding and avoids many eating food and daily chores. On detailed history, he had a hobby of painting small cartoons while he was about 6 to 7 years of age. So he had more than 10,000 of those cartoons. Mother had taken a picture of so many collections. Diagnosis was definitely OCD with poor insight. We had started him on medicine. And alternative modalities, we have asked him to snap what you see different. So whenever he used to take a photograph, to our amaze, he had captured so many beautiful images. And post-fame, he said that on taking pictures and photos, he feels very relaxed. And eventually, we had bring him down with that same thing. So what is the pathophysiology, or how does it help the person to come out of OCD? So how photography helps as a distraction in OCD? It redirects focus. Photography requires attention and detail, which shift focus from obsessive thoughts to the present moment. And this cognitive redirection can break the cycle of repetitive thinking. So it also promotes mindfulness. As Sir said, photography encourages mindful observation, noticing light, texture, color, moment, and the practice helps individuals in reality reducing the power of intrusive thoughts. It also encourages creativity over compulsion. So OCD thrives on a rigid pattern and fear-based repetitions. Creative activities like photography allows for a flexibility, imagination, and personal freedom, which counteract the compulsive behaviors. So it also provides a sense of control, like often involves fears of losing control, while photography individuals can conscious choice for framing, exposure, editing, and a healthy sense of agency is established. So there is a great sense of control which is involved with photography. It replaces the unhealthy routines. Like instead of performing a compulsion like cleaning or rechecking, a person can grab a camera or a phone and can focus on capturing a meaningful image, which helps to build alternative and positive routines. So now I would ask the public that what does this photo say? If anyone can pop out some information out of this photo. So I'll go ahead. This woman in the image appears to be posing for a self-portrait in a calm and composed manner. She is making a direct eye contact with the camera, which signifies strength and vulnerability both. She is partially covered with a towel, shows some scarring on the chest, which may indicate a personal medical injury or a ongoing physical abuse. So her expression is neutral to sober. She does not smile, which may suggest serious or introspection. The setting is minimalistic, possibly indicating a controlled or a reflective environment. So we can come out to see, we can know the emotion of a person on seeing a photograph also. So this is how we can interpret a photograph. So possible interpretation with care was courage and self-acceptance. The direct gaze and the exposed scar may indicate a deliberate act of reclaiming her body or identity, often associated with healing and or personal empowerment. Vulnerability and resilience. The unflinching presentation of physical scars might reflect emotional strength and effort to process trauma or a significant life event. Contemplation and introspection. The subdued expression could suggest she is in a reflective or emotionally heavy state of mind. So likewise, different about this photograph, I would say, this photography as a healing we can use. Photography is widely recognized as a tool for mindfulness and emotional expression. Capturing moments encourages focus on the present, which can reduce stress and or depressive thoughts. The act of photographing something beautiful like sunset can suggest appreciation, creativity, and engagement with the world, and a sign of positive healing. What about this picture? The child uses bright and varied colors, which often suggest positive emotions, creativity, and comfort with the expression. No excessive use of dark or aggressive colors like all black or red in an ominous way, which might sometimes indicate distress or activities. On subject matter, the drawing features a horse, a pet, a sibling, a heart, suggesting themes of family, love, safety, and this generally healthy and emotionally secure subject, which is presented with this photo. The writing says something like my house, my dog, my sister, though it is reversed or mirrored, which is very not uncommon for the age in a developing phase. So misspelling or mirrored writing are typically in early childhood, which are not usually cause for a common concern unless presentation will be beyond the age. The style and structure of the pictures suggest that the figures are recognizable and detailed, showing developmental appropriateness. The house has a window and a door. The dog, the sibling are distinguishable, signs of normal cognitive or fine motor development. Though this child was diagnosed case of autism spectrum disorder. So we had taken this picture, who had painted this picture, and we had taken a photograph of him just to identify the emotions attached with the picture. Again, another picture, which was a sketch and we've been taken into a photograph. The subject and the expression, the character is sitting calmly with a soft expression and a downcast eyes. This might suggest introspection, gentleness, or even a touch of shyness or sadness. The flower in the hair and the peaceful setting on a rock, possibly near water, indicate a child who may be thoughtful or realistic, idealistic. Use of pink color, hair, dress, often linked to loud warmth and desire of connection. So green vest, again, green can symbolize growth and calm and harmony. The mix of bright yet soft colors shows a balanced emotional state and expressive but non-chaotic nature. So detail and composition, the character is well drawn, proportionate and detailed. This may indicate good fine motor skills, age appropriate or above cognitive development. And sitting alone could be a hint of preference for solitude or quietness, possibly feeling of loneliness and depending on this. So what would be the mental health interpretation of this picture? The child sees emotionally aware, reflective and imaginative. There are no signs of aggressive themes or excessive fear or chaos. If the child often draws solitary figures, it might be good for gently explore whether the feel socially connected or if they just enjoy the themes, quiet themes. Though this case was a diagnosed case of major depressive disorder. So this was the picture which was drawn by the child. And some details about this photograph of a couple popping out the tongue. So psychological archetypes or insight, the inner child, they are saying that the connection with a part of themselves that is playful, free, and fully presentable. Child experiences healing. The couples appears emotionally attenuate, which is a key in emotionally focused therapy for couples. Rain as a symbol could often represent cleansing, renewal, or emotional release. It's joyful and non-melancholic, which might signal reframing or hardships in connection. So therapeutic use of such images like a photo like this could be used in therapy also to explore the ideas of joy, vulnerability, and trust, discussing the emotional expression and comfort with the intimacy, and encouraging reflection on what do you feel mostly free or connected. So using photography as a tool for meditation, we can definitely use it as a tool for meditation. Like it anchors your attention and can help to reduce wandering thoughts, especially with personal photos like family drawings or childhood art. It can bring up memories, emotions, unconscious material in the gentle way. Compassion and gratitude can help with, and meditating on a loved one photo can help in cultivating loving kindness or a gratitude. And it can help some people meditate on religious and spiritual icons, which can help them to connect with the deeper insight or a spiritual connection. So how do we meditate with a photograph? So find a quiet place and sit comfortably. Place your photo in front. Take a deep few breaths. Gaze at the photo, not analyzing, just softly observing the image. Let thoughts and feelings arise without judgment. If mind is wandering into some other things, gently bring your focus to the image. End the session with few deep breaths and gratitude. Even 5 to 10 minutes of such powerful gazing can help you to meditate. You can meditate on any image, any photo, any picture, or any deity or any god also. So different types of photographs show different fragmented things in the life. Like when there is fragmented identity of a person's face broken like a mirror, each side showing a different emotion or version of themselves. When a person is hallucinating, some floating eyes in the sky, glowing objects, invisible figures barely visible in the background can be seen when a person is having a delusional belief. Someone photographing in the sky, wires or TV, as if they hold some secret message, and so on and so forth. So many photographs has so many meanings associated with the same. Now, photography can present as an expression of psychosis. There can be distorted reality, unusual angles, surreal edits, or abstract compositions. In paranoia, images of cameras, eye shadows, and being watched can be seen. Symbolism, like ordinary objects, can take an exaggerated or mystical meanings, or in fragmentation, blurred faces or broken mirages can be seen. So we can know many things from a photograph. Now, photography in mental health treatment. So how can we use photography in mental health treatment? Photography is used in art therapy or narrative therapy for people with psychosis, like building insight, seeing how they interpret or portray their world. So expressing non-verbal emotions, especially helpful when the thought process are disorganized. Like in case of documenting recoveries, also we can use photography, and in empowering, like giving control to individuals and choose what and how to see. We can use photography. Now there are some random ways of expressing emotions and remembering things to do with a photograph. Like this lady has taken a photograph of things which she was collecting cumulatively to just remember that she wants to do so many things in her life, like glittery cushion to meditate, like glows to dream about, going to Scotland, and so on and so forth. So many meanings or memories which are associated with this photograph for her. Like another one, like again the photograph of so many things she had taken, like a toy spider to hug during the anxiety attack, like other people's photo found for flea markets just to wean off from anxiety, and so many other meanings he has connected with the photograph. This was a photograph of burnt traumatic experience and just a person coming out of HIV or post-HIV diagnosis. There is still some hope left with the diagnosis with the HIV. Again, the similar kind of photo taken by an HIV patient, linking that so many things are disturbed in the life, but there is still some connection left in between. Again, similarly, picture of an HIV person. So I would be happy to share some little photography skills in me. So these are some random clicks which I have taken in my life, and so many more are there, but I will be happy to display few of them. Thank you so much for allowing me to give some insight on photography and mental health.
Thank you, Dr. Jeet Natpara, for a great, very beautiful presentation on photography and mental health. And thank you. You shared a very nice seminar kind of a presentation, and you also included your case perspectives, art therapy, and some aspects of applications of photography in therapy and mental health, and your personal journey as a little photographer. So I think it is now you will someday become a very big photographer. So we are very esteemed to have you on this show. And I think with all such big photographers and psychiatrists have added huge insights in photography and mental health, and we have still some more talented photographers and psychiatrists who will be sharing their one photograph and discussing it. So thank you, Jeet, for being part of this present panel speaker presentation, and we request you to please stay back for the panel Q&A, and in just over the next 10 to 15 minutes we will be having the photography session. We request Lisa to show, I will read the CV, then she will display, or the psychiatrist will display the photo, and they will then keep it for the screen for some time, and then they will discuss their photography. So the first photographer and psychiatrist in the photography session is Dr. Amol Deshmukh. He is director of Antarang and Disha Psychiatry Hospital, Chhatrapati Sambhaji Nagar, Maharashtra. He's faculty at R.K. Damani Medical College and SRIMS CSN, founder member of statewide national award-winning awareness project Gav Tete Manas Upchar, member of Punk Foundation Aurangabad. He's been very active in the IPS Western Zonal Branch. He's a chairperson of Rural Psychiatric Health Committee, IPS Western Zonal Branch, and chairperson of Task Force of IPS. Other interests include acting, writing, and photography. He's acted in significant role in international award-winning film Chand Sase and lead actors in various dramas. He's a column writer in various newspapers and magazines like Lok Satta, Mata, etc. We have a very it takes us immense honor to welcome you, Dr. Amol Deshmukh, and I request Lisa to please share the photography. Over to you, Dr. Amol Deshmukh.
Thank you all. And this is a very wonderful webinar by our committee, that is Art and Cultural Committee. I'm very happy that various activities are going every month, and thank you to the Darpan ma'am for taking lead and doing it continuously. To my photography as a hobby, this is my photograph clicked by me last year when my wife was making Ganpati of a Shadu sand at home, and I saw the image reflecting in her eyes while she was making the Ganpati. So I thought, why not? I should click this click, and I took my camera, and in one click, I have catch that picture of Ganpati in the eyes of my wife. So it was very emotional moment that I could catch this Ganpati in the eyes, and it has lot of emotional, spiritual, and value which keep me reminding this photograph many of the times when Ganpati festival comes. And it makes me and my family very happy that I could catch during that moment, because during Ganpati festivals, all the happenings going on in the family while making Ganpatis and festival preparations, and this hobby has indulged into that festival environment is like a very soothing experience for me. I started my photography as an amateur photography when I passed my MD at BJ Medical College, Pune. And while doing my post MD lecturer post, I was searching for various places where can I click the photographs. I like learn photography. This was in 2011, where I attended various workshops in Ferguson College, Pune, where I learned the photography, the basic skills of photography and the camera and all those things. Later on, many of the times that happens, ki camera is replaced by the mobile, and we could able to click the good photographs also with the mobile also. That other photographers in the group can also agree. Um, so whenever I go outside for any vacation or any journey or any outside with the friends and any parties, I carry my camera. Even if I forgot my camera, I try to take various angles from my mobile. And iPhone has very good quality camera. So whenever it is possible, by either by DSLR or by mobile camera, I take photos or clicks the photos, and then choose the appropriate photos, and then I post on social media, post show to my friends. And some of my photos I have displayed in various exhibitions also of doctors fraternity under amateur photography. So it was nice experience, though I am not a professional photographer, but it really makes me happy, and it gives me a confidence in a daily routine. And while I am there in the group, other people are not worried about the taking pictures. So the group cohesiveness goes very well when I took good pictures during any programs. So that's about my photography. Thank you.
Thank you so much, Dr. Amol Deshmukh. Shutter your stress is, or it's written shutter your stress, or shutter your stress is your presentation, or is shutter you stress? Shutter
Shutter your stress.
Yes, yes. So thank you so much, Amol. It's a very beautiful and soul-touching and very inspiring and spiritual photograph that you shared, and maybe it should be in future an award-winning spiritual photographer. You must say you can write that award-winning photographer also in future. So I think thank you so much, Amol, for being part of the IPS Western Zonal Branches Mani Tarang webinar series. You are the EC coordinator also of the Art and Cultural Subcommittee. So we have done 6 programs so far. 5 programs so far. This is the 6th one on photography and mental health. And thank you so much for being a part of it. And we request you to please stay back and for a panel format, just 5-10 minutes after all the remaining 2 psychiatrist photographers share their photographs. So thank you so much, Amol. Very nice and very awe-inspiring photograph you have shared. Thank you so much.
Thank you. Thank you.
Yes, yes. So now we will be introducing the second photographer, psychiatrist. Dr. Colin Braganza is a psychiatrist and a senior resident at the Institute of Psychiatry and Human Behavior, Bambolim, Goa. He completed his MD Psychiatry in 2022 and was awarded Goa University's Gold Medal for the same. His other interests include Colin is a nature enthusiast who enjoys watching, documenting, and taking photographs of birds, butterflies, tide pools, and wildflowers. So we welcome you, Dr. Colin Braganza. Over to you.
Thank you so much.
And the title of his photography is It's All Falling Apart. Still, have you seen such a beautiful world? We welcome you, Colin.
Yes, thank you. Am I audible?
Yes.
Yeah. Hi, I'm Colin. I'm a psychiatrist from Goa, and more than a photographer, I consider myself a nature enthusiast. And over the last decade or so, I've had the privilege of exploring the length and breadth of Goa's forests, mangroves, shores, mountains, as well as a large part of India too. All right. And today's picture is something that is from a place closer to home, just 6 kilometers from where I stay, in a quaint village called Sioli. All right. And any psychiatrist looking at this picture will probably get a more direct meaning that, okay, this is 2 birds looking away from each other, kind of like some interpersonal issues or something. And perhaps the meaning from my title, It's All Falling Apart. Still, have you seen such a beautiful world? Or my alternate title was Bird Songs in a Burning World. All right, which essentially would kind of imply that, okay, there's when there are interpersonal stresses where there's distrust or conflict, we can't appreciate the immense beauty that's there around us. But I also have a more contextual meaning for this picture. All right. The more contextual meaning I have is related to the birds and to the world that we currently live in. All right, back in 2020, the term doom scrolling came up during the COVID-19 pandemic, which was referring to a compulsive consuming of negative news and information through social media, which impacts one's negative health adversely. All right, and nowadays, even regular scrolling can feel like doom scrolling. The live genocide we are experiencing and helpless to change, wars, a climate crisis, floods, landslides, rapes, murders, and collapsing governments and institutions. And of course, our lives, we see a lot of grief, loss, and helplessness. And it feels like a burning world and feels like things are falling apart. And at the same time, there's so much beauty, which I've represented here by the birds over here, along with the sunset. The birds are Malabar pied hornbills. So one thing about Malabar pied hornbills is they're there a lot more in the southern and the western part of India. So the entire west zone, Goa, Maharashtra, and parts of Gujarat have representation of this bird. Okay, and one thing, and I'm sure many of the people here have seen hornbills and been wowed by hornbills. And one thing, the moment you see a hornbill, that moment seizes you. You're just awestruck by their beauty. You're supposed to be in the present. And like Dr. Jai, Dr. Chetan, Dr. G spoke about mindfulness and being in the moment. And one thing, seeing birds like hornbills is that they compel you to be in the moment. All right. And hornbills are lovely birds. They are a symbol of love in many cultures, including many Indian cultures, because they are monogamous. They mate for life. In fact, 13th February in places like Thailand is celebrated as Love Hornbill Days to share that the knowledge about hornbills and to their symbolism in the context of love, and also to raise awareness. And while we are awestruck by the beauty of these birds and we revel in the joy that seeing birds and being in nature brings, there's also a flip side. So, like if we consider these very birds, the Malabar pied hornbills, the recent International Union for Conservation of Nature reclassified them as near threatened because their populations are decreasing related to habitat loss. And in such context, you realize that there's hope and despair, and these are not different sides of the same coin, but they coexist together with this beauty, to this wonder, to this joy that being with nature brings. Okay, so the positive effects of nature and mental health are well known. And I think Dr. Chetan covered that beautifully, as did the other speakers. So I really don't need to go into that. But there's this book called Bird Therapy by Joe Harkness, who also experienced a mental health issue and speaks about that. And in that, he says, when life feels overwhelming and the world becomes too loud, there's a quiet place we can retreat to, the natural world. All right. And being in nature offers that space, that sanctuary for peace, the opportunity to be in the moment, a source of joy, fulfillment. And engaging in nature provides a buffer from the overwhelming weight that the world and life puts on our mental health. And given that connection with nature is affordable, accessible, and a great way to improve our mental health, given India's treatment gap, I think every Indian psychiatrist, as towards mental well-being, should be, and often many are advocates for the nature and the conservation of nature. And I think Greta Thunberg, climate and political activist, also someone with autism spectrum disorder and a lived experience for depression and obsessive compulsive disorder, said it better than possibly I could when she said, I quote, "It's so weird to me that people are separating caring for the environment with caring for humans. I care about the environment and the climate because I care about humans and well-being. Those are the same things. And in my view, there can be no climate justice without social justice." Yeah, I unquote. And getting back to this picture is more than just a picture, it's a memorial. Because this place, which I clicked this picture at the start of my SR-ship in 2022, this place is no more there. The trees have been cut off for bungalows and some villas, and the birds no more visit this place. So this serves as a memorial that at times when there's a changing world, there's loss, there's also hope, there's so much beauty, and there's so much worth protecting, worth fighting for. And the reason I chose this was to share this memorial and the beauty that we experience and the resilience that the natural world shows. True resilience lies in the ability to stay with these conflicting emotions, this hope, this despair, in the face of grief without retreat, and to act with integrity even when the path is difficult and our outcomes are uncertain. Some years ago, in the Australian Psychiatry Journal, a researcher called Glenn Albright spoke of one of his qualitative studies, spoke on a word called solastalgia, which was the pain people feel when their environment is under assault, and homesickness while they still have a home. I think that in addition to the immense beauty that nature and photography brings, it's also this other aspect that we should always look at, the flip side, and try to balance the hope and the joys with the challenges, and be people who and psychiatrists who work towards conservation and safeguarding. And I, of course, thank the IPS Art and Culture Subcommittee for giving me the opportunity to speak here. Thank you.
Thank you so much, Dr. Colin Braganza. It's a very beautiful photograph that you have shared, and your excellent narration about the photograph and description. It's an inspiring photograph because you've titled it so beautifully that it's all falling apart still. Have you seen such a beautiful world? So I think it's a perspective and it's a great message for the world. And it's a very beautiful award-winning kind of a photograph. So thank you so much, Dr. Colin Braganza. And
Thank you so much, ma'am.
the panel discussion, which will be shortly in the next 5 to 10 minutes. We have our third psychiatrist and photographer. We welcome Dr. Arya Prabhu Gaonkar. She's a private consultant psychiatrist in Margao, Goa, with 10 years experience in psychiatry. She's a past consultant psychiatrist at District Mental Health Program, South Goa. She's worked at clinical research organization IQVIA for 3 years. She's past secretary of IMA Karchoram, Goa. Her interests are photography and trekking. So over to you, Dr. Arya. And Lisa, can you please display her photograph? Yes, her photograph is titled Photography as a Stress Reliever. We welcome you, Dr. Arya.
Hi, thank you. Just a minute, I will put on the video. Yeah, am I visible?
Yes, yes.
Okay, so I kind of, was actually going to what other people are saying, and like this beautiful photograph. So I really thank you people, for inviting me and to showcase the photograph that I have. It's not, I would not say, it's an award winning or something, but it's from my perspective. Like this was, a kind of stress relief for me. I remember this photograph being taken some years back. This was during my post-graduation time. And, I needed to, de-stress, like, those 15 days or, 8 days of that grueling week that you have, like hectic duties and, the stress of studying and all that, along with, seeing OPDs and all that, which is new to you. And, I needed to relieve that stress. So I would go, on weekends or whenever I'm free, to a beach, which is, like we are lucky as Goans that we have a lot of beaches in Goa and they're beautiful. And, you can capture these like sunsets and early mornings, and it's really nice. It comes, even if you are a mediocre photographer or you have a bad camera, it still would turn out beautiful. So about this photograph, what I like about this photograph is that it captures the sunset beautifully, like, the sky, the all the hues perfectly there. You can see the sun, and I was trying to actually capture only the boat and the sun. So and then I noticed there was a couple standing there, so you can see the silhouette of the couple there, and the child along with them. So it shifted on from trying to capture the sunset onto the capturing the beautiful family which I saw over there. So that's my perspective, and I would call it as a stress reliever, because it worked as a stress relief for me. It helped me, that mindfulness, and it helped me to relieve my anxiety and my this it really helped along with my post-graduation, or the after post-graduation, the residency period, the 3 years that we had to serve in the that's the only institute in Goa, so you get a lot of patient load, and you get the work hours can be very grueling. So it was kind of a stress relief for me.
Thank you so much, Dr. Arya. And I must say, even this is an award-winning photograph. Okay, it captures the sunset beautifully with a great view of the horizon and a boat and a family which is enjoying photography, seen through a lens of a family which is enjoying a sunset, seen through the lens of a psychiatrist. So, and it has a peaceful tranquility around it. The beach is beautiful, there's silence, there's meditativeness, and there's the sun. So your sunset photograph is an award-winning photograph. It helps you relieve stress. Somebody watching this will also feel mindful, and there'll be a tranquility around it viewing the photograph. So it is a unique award-winning photograph, I would say, in future. And what I'd like to say that it's the third photograph in the series, and it marks the end of our show. So you displayed the sunset, but there will be sunrise tomorrow again. So it's a great hope to all of us and everyone who wants to look at photography as mindfulness, photography as therapy, photography as stress relief, and photography as calmness, or photography as inspiration, photography as a narrative. I think that our today's webinar presentation speaker talks and the photographs that were shared have all been very unique, spiritually inspiring, nature connected, and giving a strong message to the world outside. So that is the beauty of Mani Tarang. Thank you all 6 psychiatrists for participating, and thank you Dr. Arya Prabhu Gaonkar. I request the technologist and Lisa to just quickly make a panel spotlighting the 3 speakers and 3 photography participants, as well as Lisa, you as the moderator, and myself as the chair. Can you make a quick spotlight panel? Is the Siddha technology person there?
Yes.
Can you spotlight?
Yes, ma'am.
Yeah,
Amol
you
is
need
missing.
3 dots at the end or at the side, and there'll be spotlight for everyone. Yes, so you start spotlighting everybody. Dr. Jai, Dr. Chetan, Dr. Lisa, Dr. Jeet, myself, Dr. Amol, from the participants. Yes, then Dr. Colin, Dr. Lisa. Lisa, please spotlight the other 2 as well. Myself. I can't see their names, Lisa. If you can see them, please spot.
Yeah, Dr. Arya also. So
Yeah.
that's technology as well
Yes,
as iPhone, the Dr. Amol.
Yes. Dr. Amol. Can you spotlight? Yes, yes.
Yeah.
So I welcome you all, and as it's a photography session, I will take one picture. So please say cheese, look at the camera. We'll take one more. One minute. There. Okay, Lisa, please go ahead with your moderation. Right.
Yes, first of all, thank you everybody for the amazing insights into photography. I did not expect it to go into so in depth and learn myself much more than I thought I knew about photography and mental health, including the amazing display by our amazing, talented psychiatrists, the speakers, as well as the other 3 psychiatrists who explained to us about photography, what it means to them, the narratives, and it's really inspiring. I would say that I think I will start myself taking photograph probably to attempt to do mindfulness for my aspect as well. So going to the questions part of it, I think in the chat we do not have because it was a very mind-boggling and very informative session, I think. But I do have a couple of questions. So thank you, Dr. G, for speaking about the new technology and the role of AI. So I had a question, sir. Now with AI, we have a lot of image morphing, and with, as you mentioned, body dysmorphic disorders. Have you, sir, seen any or experienced lately a sudden rise, would you say, because or any worsening or any experience in this sort of disorder in terms of AI coming in the play?
No, I think it's a great concern, Lisa. We do see a lot of patients, especially in the younger age group, the adolescent age group, where they are such a great tech-savvy individuals, but at the same time, in terms of developmental space, they have their own challenges in the sense they are not mature enough to know the consequences of their act, and some might take it as just a joke and not worry about the kind of impact that their act will have on the other parts. And it's all about likes, right? How many thumbs ups you get or how many likes you get, and life has almost revolved around that, and people will go to any extent and length to make sure that whatever technology is available to them and whatever resources are available to them, but they want to be seen, they want to be heard. And of course, it's a great concern. The the perpetrators, the victims, everybody needs to be considered when you are trying to handle them. I guess the victims are the first one to report, but I can tell you with guarantee that even the perpetrators have enough psychopathology to work on. So it's a developing space for us as a mental health professionals. AI is definitely going to create a lot of scope of work for us, unfortunately. But yes, we have to be mindful about that, definitely.
Yeah, thank you for sharing those thoughts. I couldn't agree more with you, Dr. J. Yeah, it is a bit scary nowadays, I would say, with the AI coming in the picture. Okay. Yes, Dr. Chetan, I had a question for you too, sir. So now there is this concept called photojournaling, they say, where could you maybe share some, considering you yourself are have a lot of passion for photography. Do you think it, how have you implemented it in any patient?
Definitely. Nowadays, the new concept is photojournaling, means a photograph associated with some good notes or some information associated with the photographs. That kind of help to you create your more self creativity increase, or you are experiencing or whatever you're noting some experience during that photographs. That definitely help, and this photo book nowadays is a more new concept. A photo with some source notes from the beginning, from the birth to the end. Many people, especially I come to know about my non-relatives, have each and every photographs of her son. Nowadays, he is around 29 years old. Everyday photographs he had. Everyday photograph from the birth to 29 years age. 365 years days, not a single photo missing. It might be a world record. But this type of creativity or sometimes say keenness to the photograph helps you.
Thank you, Dr. Chetan, for giving that personal touch as well as the experience you see in your clinic. Yeah, thank you for that. Yeah. And talking to Dr. Jeet, I had you very nicely mentioned about how emotion-focused therapy and how you see the progress. I wanted to know, sir, any experience in terms of seeing depressive patients, like to see their evolvement over time in terms of treatment responsiveness, in that aspect. Any thoughts on that, sir, or any?
Yeah, one of my patient, I had seen that I asked him to show his picture gallery in the camera. So when I noticed that he was in an emotional despair mood or very sad and very despair, the pictures he used to take was very blurred, very dark gray, sitting idle in the room, staying away from the sunlight. And once he was out of the treatment, again the same thing which was changed was the gallery was very colorful. So definitely I give some of them a task of doing this kind of things. And when people keep on asking that, sir, और कुछ बताइए, और कुछ बताइए, और नई चीजें बताइए. So I just ask them to take a selfie every day. So how you are feeling today? So he had a album of that selfie that from day one, going, smiling face, from a depressed face to a smiling face after 3 or 4 weeks of treatment. So definitely we can use photography in many ways. And definitely AI is coming nowadays in a big boom. So there might be some consoles kept in the psychiatric hospitals or clinic that come and take your picture and you will get the diagnosis.
Yes, I mean, nowadays we do hear of where even this concept where what you verbally speak, you can generate the images also. I mean, that is also another concept I heard, which is very interesting.
Many of them are doing some signature analysis and calligraphy analysis and all. So these are all skills of photography only, which are in a different way.
So a lot of potential that still needs to be tapped into, I would say.
Yeah.
Yes, but really, I mean, take-home messages also that there's lots that photography can help us, be it in therapy-wise or in evaluation-wise and all other aspects. And I think our other three esteemed psychiatrists have very elaborated very much how it impacts So maybe I don't think I have more questions, but yes, to Dr. Darpan, if you have, we would like to hear your inputs and your experience.
Okay, Lisa, as I'm the chair, I will give my inputs a little later, and we will ask the inputs from Colin, Arya, and Amol, and then I will share my inputs after as my comments towards the end as a chair. So, Lisa, I request you also. So, I think that these are great presentations going on, and Lisa, you're moderating it excellently. I just have one also comment. I will give it in the end. But let's finish with Dr. Colin, Dr. Arya, and Dr. Amol on the panel. And then I will invite maybe the participants. If anyone would like to ask, we can ask them. So over to you, Lisa.
Yes. Dr. Amol, if you would like to have any comments, sir? Any
I have talked
advice for us on
while
it?
talking to my photograph, but you can show my other photographs if you have.
I would need to look. I don't have it right now, sir.
Yeah. Okay. I will post on the group so that all can see the new things. So it's a good activity. I think we should not be a perfectionist to click a photo, but we should enjoy that moment of capturing anything with any camera you having. Like we capture many of the things haphazardly in a program, but after thinking, if you click anything, then you can capture good things. Like, yeah, that's it.
Thank you, Dr. Amol. Dr. Colin?
Yeah,
Would you
one
like
thing
to
I
say?
want to compliment the Art and Culture Subcommittee of the West Zone for choosing this topic. It's something that's, I think, very practical, very relevant, and more so with photography, which has become ever so accessible, with each of us having phenomenal cameras a- on our phone, always, almost always in our hands. It becomes photographs are a great way to, like, they serve to as this kind of thing to, like, serve as memorials, like safeguard what it is. The moments before, the moments after might just fall off like the end of the cliff, but that moment stays. And this act of capturing, I think, is apart from the mindfulness, joy also serves as this of adding to our understanding of the world, adding to us being present and really experiencing the world and understanding the world a bit better. And definitely the mental health benefits have been discussed, and it's great that the committee has decided to go ahead and share this with the West Zone and with the world. So congratulations to you all for choosing this topic and carrying it out so well. Yeah.
Thank you, Dr. Colin, for those kind words. It's inspiring for all also. And I think, people will be more this to go into nature, at least take a walk, looking at the amazing, I would say, landscape as well as wildlife pictures that all our esteemed psychiatrist panels have showcased us. And it's been very inspiring, I would say. Yeah, Dr. Arya, would you like to say a few words about it?
Lisa and all of you. It's a nice, I would say, offbeat topic to start with. Photography, something which is very accessible, as Colin pointed out. But like we don't think in terms of psychiatry, and it does help. Like on a personal connection level, I do think that it helped me, and it also helped me to connect with my child. Like my child is 7 years old and he's hyperactive, so kind of he has this in some moments wherein he has hyper focus. So we try to, he would always see me with the camera. Like whenever we go out, I always carry my camera, so that I could picture, I always like nature. So I kind of try to click nature rather than clicking people, like that's what I do for psychiatry. But then, like, clicking nature is kind of my thing, like birds or nature. And then we discuss about the birds. So, I saw that he's also getting interested. So then, he started asking me about photography. So I taught him some little basics that I could. And then I do help him, give him camera when I am around, not like by himself. But I noticed that like how I am good with nature, he's kind of good with people photographs. So that photograph, which is mine, which I gave you for this thing, is clicked by my son. So he kind of likes clicking people, and I have seen that he gets like really good with it, kind of. So that is what my experience is, that it helps, you know, kind of mindfulness. It helps him to focus. And so photography does help. Thank you.
It's nice to hear your personal experience, you know, how you implemented for your own kid, how he was mirroring the use of photography in terms of focus and, you know, calming himself. I mean, it's really nice to hear how you are using it on a daily basis. And I think that's, much more informative for all of us as a, you know, a practical example, I would say. Thank you for sharing that, honestly, Dr. Arya. Yes, over to you, Dr. Darpan.
Okay, thank you so much, Lisa. I just see that in the participants, I'm myself trained from CMC Vellore. I'm seeing that somebody from CMC Psychiatry Vellore has joined. If they would like to ask any question or share any comments, we cannot see who's there. But if you're there, please, from Psychiatry Department, CMC Vellore, if any one of you would like to unmute your mic or start your camera and share your thoughts on this presentation, because we have lots of photographers even in the Department of Psychiatry CMC group. Would anyone like to ask a comment or share their thoughts? Please, we invite you. Psychiatry Department, CMC Psychiatry Vellore. Yes.
Nessa from Department of Psychiatry, CMC. So I saw this an open link for the Zoom meeting in the MHC official group, and I was very intrigued by the topic and I wanted to join. So this is my first time in the Zoom meeting. So thank you for the inspiring topic and discussion. I was looking forward for this discussion for a while, and yeah, thank you, ma'am. Thank you for the invite.
Thank you so much. Thank you for, taking out your time and attending on this topic. Anybody else from the audience would like to unmute themselves or would like to ask any question or share any comment from the audience? Anybody else?
I'm not related to the topic, but I would like to invite you all for the YP Summit, which I'm conducting this time at Daman. So there's a great chance of photography in Daman, so you can all join.
Yes.
Thank you, Dr. Jeet. Okay, so I'd also like to let you all know that please, that you all participated in this webinar on photography and mental health. We will be coming out with a book on Mani Tarang, maybe somewhere this year down the end or next year or in this year itself. So you can think and write some chapter on photography and mental health. So all the webinar series, if possible, we will try to come out with a book on it by the zone. And please write your chapters on your thoughts, your journeys on photography and mental health. The second thing is I also would like to invite all of you that the Art and Cultural Committee would be doing one program in person, a CME, maybe either in like August, September time in Mumbai. And we invite you all to come and attend if you can. And at least the ones in Bombay, Dr. Jai, you have to be a part of it. And we will have the same one-day format of different aspects of creativity. And even if anyone out of station would like to attend, please, we'll invite you and we can put you in the program and let us know your thoughts when you see the announcement on speaker, or there might be some exhibitions or something planned. We also plan one, either an online or in-person exhibition, which we might put it with the CME, or maybe do it at the end of the at the zonal conference in October, or maybe have an online. But one exhibition of photographies and art is also planned, and we will invite you again to share your entries for the exhibition and the book, and the in-person event. These three activities are planned for the next 3 months. If we can go ahead with all three, please be a part of all three. And I'd like to share a few points on my journey as a photographer. I generally like photography. Some of you must have seen some photographs. I generally like nature, birds. There are some plants that grow in my window, some flowers, and some monuments, sunsets, sunrises, nature, cities. These are, and humans, and emotions. These are all areas that I like photography. Some of my photography also inspires me to write a poetry. So if you've seen some poem of mine, it might have some photo with it, and the photograph has got me, is clicked by me, and the poetry is always very momentary with the photograph. In a second, the photograph would inspire me to write a poetry, and it would be just so quick, and then I'll put it all together. So I generally like to also write like a photo poetry kind of concept. And the other thing is that sometimes I've also written some, story or something which got inspired from a photograph. So photographs are also in my creative journey, links to write poetry and stories also. And sometimes just looking at a photograph that I click, we get a connect, and the connect and it syncs with our brain. So I think to all the photographers here, I'm sure they'll understand that it's a flow experience or it's syncing. And once you've seen the photograph, and there'll be some, whether it is a meta psychological, metaphysical, but some momentarily, all the photographs will get mesmerized by that same photograph, and then they'll get that thing, no, I need it as a photograph. And photographs also make very beautiful memories, and great emotions are attached to all photographs. So it's very nice to listen to all the psychiatrists who like photography, and I'm sure that everyone's amygdala, hippocampus likes photos. Okay, so everyone has beautiful memories linked with them, their own creativity. And I just want to share two more impromptu experiences while we were doing this program. A very beautiful tailor bird came at the beginning of the program. I clicked its photo, and now towards the end also, I think during the panel, the microphone was on. It sang a small song, or a 3-second. I clicked its photo, and it hummed into the webinar. So I think that the tailor bird outside is very pretty, and I think has congratulated all the photographers. Message came from the nature world that carry on your great work on nature, bird, floral, plant photography. And there's two pigeons also in the window. They're also trying to talk something, and they're there. So a beautiful message from the bird world, plant world, trees world, everywhere. So I just want to say that keep on photographing, and we will work together for some more good collaborations on this beautiful theme. And I'd also like to thank personally Dr. Jai, Dr. Chetan, Dr. Jeet, Dr. Colin, Dr. Arya, and Dr. Amol for taking out their valuable time. And our programs, you'll have given such a beautiful experience. It's, I think, immersive experience, immersive reality, and momentarily immersive beautiful experiences webinar on photography has created. And I'd like to appreciate and thank Dr. Lisa Mascarenhas, who's put in all the hard work to conceptualize this program along with me. And we earlier had Dr. Sanjana, who was also our member. She was supposed to organize this program, but because she couldn't take it up, and for personal reasons, and I called Lisa, and it was a very short time, but she agreed and coordinated with all of you up, and we set up this beautiful panel. And it's truly Western in its spirit, because it represents Maharashtra, Gujarat, and Goa in its truest sense. So thank you, all of you, and thank you all the participants who attended this webinar. This webinar link will be uploaded on YouTube, and the link will be shared with you all through Lisa. It's there on the IPS Western Zonal Branches YouTube channel, and others will also view it later. And then you can share the link with your other photography, psychiatry, or other groups as well. And so thank you once again, everybody. And I also like to thank the president, Dr. Sudhir Bhave sir, who's given us, this inspiration to form this committee and conduct wonderful webinars in the brand name of Man-e-Tarang webinar series. It's my concept and my coining, but the whole committee has contributed beautifully to it. And we also would like to thank our secretary, Dr. Abhijit Pai, and our committee members, which is Dr. Mulmule sir is the advisor, myself as chair, Dr. Amol is the EC coordinator, and then we have Abhijit we have Dr. Alkesh as our convener, and we have 3 members, Dr. Lisa from Goa, Dr. Sanjana from Maharashtra, and Dr. Nissar from Gujarat. This is our this year's Art and Cultural Committee, which has been doing great work. So thank you so much, Lisa. And I think that there's a formal word of thanks which Dr. Alkesh is supposed to give, our convener. If he's there, he can give the formal vote of thanks. If he's unavailable, Lisa, I request you to give your vote of thanks. Over to you, Lisa.
Thank you, Dr. Darpan. I think Dr. Alkesh could not make it, so I would propose a vote of thanks. Yeah, on behalf of the Art and Culture Subcommittee, West Zone IPS, I would like to thank, first of all, our President, Dr. Sudhir Bavi sir, our Secretary, Dr. Vijit Pai, and our Chairperson of the Art and Culture Committee, Dr. Darpan, and the entire team, including the members who helped with reaching out and getting the resources for today's amazing webinar. And most importantly, all the panelists here, the speakers with the amazing display of your photography, going to depths and the narratives. It's really inspiring, I would say. I never imagined photography had a lot more than what the eye meets, at least what I thought. That was my personal experience.